And Texas has reported its first Zika-related death. A baby girl whose mother traveled to El Salvador died shortly after birth in a suburban Houston hospital. Florida health officials have just identified 4 more local cases of the Zika virus in Miami's Wynwood neighborhood, the only site of active transmission in this country. The cases bring the total number of locally transmitted cases in South Florida to 21. The latest CDC numbers show 1,825 Zika cases in at least 46 states. Joining me now to talk about Zika, there are growing concerns about Hillary Clinton's health. Dr. Marc Siegel, clinical professor at the NYU Langone Medical Center. Dr. David Samadi, chairman of urology, chief of robotic surgery at Lenox Hill Hospital, both Fox News contributors. Great to have you with us.
Great to see you.
Let me start. Dr. Siegel, let's deal first with the Hillary Clinton issue. We've looked at a number of images of events that have taken place over the course of the past year. There seems to be a real problem there. How concerned should people be? How concerned are you?
Well, I think that we have a right to know, and I think that we established a bar with John McCain in 2008 where I was one of the journalists that poured over 1,200 pages looking for a melanoma they had 10 years before, finally pronouncing him fine. I thought we changed the bar at that point, and that now when someone was approaching 70 years old, and that it's both candidates, we should be able to look at full health records, especially in her case, someone who has had several falls, someone who had a big concussion where she couldn't see right for a couple of months, someone who had a blood clot on the outside of the brain and is now on lifetime blood thinners. We have a right to know fully what a neurologist says about this.
Have you, and very quickly before I turn to Dr. Samadi, have you seen anything in what, whether it be the assistance she required to get up the stairs, whether it be her losing her train of thought, speaking before a group, does any of that appear to be the result of a blood clot or some other neurological injury?
Well, I can't tell, and I can't tell from a video screen, Lou. I can tell you that someone that's prone to falling, like the fall in February, or where she was being helped up the stairs, someone on blood thinners, I'd be concerned that you could hit your head. So I have enough to be concerned and want to know more information, but I can't make a diagnosis.
Dr. Samadi.
I think, you have to look at the facts. And the facts are that in 1998, she had an episode of deep venous thrombosis. She had a blood clot. So is it as a result of her traveling all over the world and she's up in the plane all the time? That's where it started. Now, there has been multiple falls. That's what the question is over here, 2011, 2012. What we know is that that concussion took her a long time to recover. And about 15% of patients, they may have some post-concussion syndrome. What does it mean? 2-3 years after, they may have episodes of fall. But, that picture is a little bit of concern. We should be careful about how much we dig into that, because she may have a chronic fatigue syndrome. She may be sleeping only a couple of hours. She may be dehydrated. So without knowing her medical record, she may have Lou, she may have even a vertigo. A vertigo is someone who may get dizzy, etc. So without knowing all the facts in a medical record, we've got to be careful about how far we're going to dig into this.
One more thing to add to that. He mentioned post-concussion syndrome. You know that the 15% can have problems with balance, can have problems with dizziness, can have problems putting thoughts together. So that's clearly a possibility here.
Now, she is on Coumadin, so she's a blood-thinning medication. That's a concern when you take a long time of that medication. But she also has hypothyroid, and she has to be on prolonged period of taking these thyroxine and medications like that. All of those have their own side effects. But based on
that medication,
yes,
and additionally, there was a suggestion that the doctor with her in attendance on that event had an injector of a
Valium, which you would use if you had a seizure problem. Now, again, we can't conclude from that she has a seizure problem, but we conclude from that we need to see more records.
All right. Let's turn to Zika very quickly. This is starting to get very scary for Americans, for all of us. Concerned about nearly 1,700 people who've contracted it. Your thoughts on...
Look, we had this segment a few months ago. I think Zika is actually a localized problem. I don't think it's going to become a major epidemic. I think people need to be concerned. And I also said way before CDC came is that if you're pregnant, don't travel to those areas because of microcephaly.
Are you in agreement? We've got about 30 seconds.
Don't travel to those areas because of microcephaly if you're pregnant. But people out there need to know that this virus is not going to spread beyond those areas. We have a big history with this particular mosquito. And if we just spray, which which we do in South Florida, and now we're introducing genetically modified mosquitoes, we're going to be able to squash this. Siegel predicts we're not going to see a huge outbreak as a result.
But no need to panic at this point.
Absolutely.
I wouldn't panic.
Dr. Marc Siegel
gonna
and
spread.
Dr. David Samadi, not only the best physicians in the country, but the most succinct. It's incredible. Thank you both.
Thank you so much for having me.